Just picked up a customer, Jonathan, a pharmacist, drug dealer, legal one. Let me just be absolutely clear. Yeah, just what would you like to talk about? Liverpool pharmacy, like what's it like, a career path? We were talking about, you know, in America it's so much more full on. What would you like to talk about?
Don't know really. I mean, it's a decent career to be in. I find it quite rewarding. Doing what I am, I work in a hospital.
Okay.
Up in the northeast, and it's quite good. It's not too bad. Can be quite full on, quite grueling most days, but it's rewarding, like I said.
Okay.
It's not too bad.
Can I test your knowledge on a subject I've asked a couple of pharmacists about?
I guess so, sure.
I recently got my blood work done,
Lovely.
and I come across something talking about homocysteine.
Homo-cysteine.
Yeah, are you familiar with homocysteine? Okay, that's okay. It's to do with, I come across something that said that check your homocysteine levels. So I went to Rodney Street and I got my levels done. So when I get my blood work done by Blue Crest, they give you a nice folder. You spend about £350. I know you can go to doctors, but the thing about Blue Crest, they give you a nice folder and it's got a traffic light system. Private, yeah. Red, orange, green, which indicates like get this checked out or don't. But it explains everything dead easy. When you go to the doctors, they give you a black and white sheet of paper that is not very self-explanatory. So that's why I like to go private. But when I went private, they didn't have information on me homocysteine, and it's to do with various different things, but cognitive decline. Sometimes I'm a bit forgetful, so when I got some tests done, and it basically means this element what I'm talking about is you're deficient in B vitamins. So you need to have more B vitamins in your diet from certain foods, liver, or take supplements. So I was just curious of your thoughts on it, but it's okay.
Like vitamin B12.
Yeah,
like
6,
yes.
the family, and just to bring your number, mine was at 14, and it said ideally, according to this guy, a lot of research, a lot of people with dementia and Alzheimer's have high levels of homocysteine. So according to him, I'm not saying it's his perspective, he said try and keep your numbers around 7 or 10.
So how would you reduce your homocysteine levels?
So increasing my B vitamins. So even though I have a good diet, for example, I won't have any food unless I'm having vegetables or fruit, but I still might not be getting the right vegetables and fruit. So I've just got to take certain supplements, but you know, I'm starting to have liver in my diet every day. So then I go back, when I spoke to the pharmacist, she explained all of this also, and lots of doctors have explained it.
Depletion of vitamin B can cause that kind of forgetfulness and things like that. If you ever look at a patient who's got dementia, check do they actually have dementia? Is it their vitamins are low? But obviously there's bigger things that go into it, to checking it.
Okay, so that's interesting. So are you confirming also that it is a sign, because this is what this food journalist was saying, that it is a sign that could lead, if it's not challenged?
It's all this in theory.
In theory?
In theory it can do X, Y, Z.
Yeah, in theory.
One of the kind of thing, low vitamin B levels. Of the like B12, for example.
Yeah, folic acid.
Yeah.
Okay. Because I just think it's important for, as you know, it's an horrific disease, Alzheimer's, dementia, and even though it's a theory and there's other factors that could contribute to it, I think if there's 1% chance that by increasing your B vitamins to diet supplementation, it could potentially help. I just think it should be more awareness. So when I've spoke to certain doctors about it, do you know what one doctor said to me? First of all, they said to me, do you know what the average reading age is for a UK adult?
Reading age?
Reading age, that's what they said to me, which I didn't know, but they said to me, well, it's 9.
Is it?
So, well, I was surprised. I googled it afterwards, and apparently there is some doctors' resources that say it. So the reason she highlighted that, because she said people don't want to know about homocysteine, most people just want the doctor to explain to them what's up with them.
Yeah.
That being said, she did say there should be more of a public awareness campaign
course, yeah.
to try and help and combat that. And also a young doctor I picked up the other day said the same. There's a lot of lectures now talking about the importance of prevention to stop people being too dependent on too many drugs.
Of course.
Yeah.
Yeah.
Turn right on Clarence Street,
100%.
using
But-
the right lane.
Yeah. Balance is important.
100%. Yeah.
Another thing, part of the channel, Jonathan, is I'm curious what people's passions are. My slogan's monetize your passion. Yeah. I'm finding out what people's divine sparks are. And what I mean by that, some people feel they've got a calling, a purpose. It's in the DNA, it's innate in them. So a question I ask a lot of my customers is, let's say you won the lottery,
Yeah.
or if most people did. Most people do jobs because it pays the bills.
Yeah.
But if you had the opportunity to do something else that gives you that fulfillment, what would you do? Is your spark pharmacy? Or is the other passions that you do?
I wouldn't say pharmacy is my passion. Definitely not. I think at the moment it's like I said, some kind of pay the bills, but it's not even. It's just I see a job there which can be good and can help help me get further in my professional development. But at the same time, I don't love it. So if, for example, if I have the choice and my plan for the next 3 years is to kind of look into the job and see if it genuinely is for me. If it isn't, I'd love to go back to university and
Turn
study
right on
medicine
Clarence Street.
to go train to be a doctor.
Okay.
And largely is because I enjoy what I do, enjoy the fulfillment in the job where I'm able to help people every single day and help make interventions wherever possible to improve their care or improve their well-being and stuff. And I try and make a conceited effort to speak to the patient, get to know them, understand their kind of their feelings on certain stuff. Like you're taking a lot of people on my ward or might speak when they come in to get history from them. They might be taking tons of medicines, and some of them they might know what it's for. They might just take whatever's there. But if I'm able to understand what they're doing, like why they're doing it, and how they feel about it, I
Okay.
try and make a difference there. But I feel with pharmacy, I find it's very limited.
Yeah.
What I can do, and if I feel in my head, if I'm able to do medicine, I'm able to make an extra step in actually deciding, not help deciding, but kind of guiding a patient's care in a certain way, make decisions and work with the team and the problem solving aspect. I'd love to do that. So that's the thing for the next couple of years. If I find my spark in pharmacy, like you said,
Yeah.
find spark,
Yeah.
stick with that, never look back, and keep going forward, try and progress however I can. If not, then just leave it, call it a day.
In a quarter
Try
mile,
something
turn
else.
left to stay on
Okay,
Russell
okay.
Street.
Yeah,
No, it's interesting because, like you say, like the girl I picked up the doctor the other day, I think with pharmacy it's very allopathic, and I think what you're kind of touching on is a more of a holistic
Yeah.
approach and
100%, yes.
trying to get to the problem. And,
Yeah.
and I think ultimately, like with everything, is balance is important, and that's another thing for the channel. There's too much polarization and division in the world in general in certain subjects, but just it's always nice to try and find the middle ground. Too many people can be a bit extreme, one or the other. And like you say, when you're working with some patients, there is a lot of cases, there's actually a term for it, where people, what the doctor was saying the other day, it spirals taking too many medications, and if you can have a more personalised approach,
100%.
especially when it comes to like personal precision medicine, and there's different interpretations of it. It can be conventionally, but alternatively, there's a big guy who I listen to from India, Dr. Shiva, and he talks a lot about this certain alternative approach in the respect of food. Include food in the personal precision medicine program and get the balance. Everything is balance, isn't it? To try and get that harmony, that homeostasis.
Yeah.
Yeah, definitely. Thank you for agreeing to this, Jonathan.
That's all good. I don't mind. Yeah. 100%. It's all good.
Okay. How you finding Liverpool?
Love it. I've studied here. I studied here for 5 years. And lots of my friends still knocking about here, so I come back whenever I can.
Okay.
I love the city.
Okay.
I'd love to move back to the northwest, whether it be Liverpool, whether it be Manchester.
Okay.
Whenever I can, if I stick in pharmacy with them, or if I'm able to go do medicine, like I said.
Okay.
It's love the city. Come back quite often.
The world is your oyster.
Thanks.
Sunderland, you're into football?
Yeah.
Just
Correct me,
ahead
I don't
to
watch sports, but I
Right
do
Street.
take an interest. Isn't Sunderland doing amazing?
They're doing amazing.
Yeah, because they've just come up from, I think, the championship,
Yeah.
and they're up there with some of the, like, I think in the top 6.
They're some sixth, and they drew against Liverpool on Wednesday.
Okay. Because I don't watch the sports, but I do take an interest, and I like the way these underdogs. Like, what's the secret then to Sunderland?
What's the secret?
So why they're doing so good? Is it the fire in the belly, the hunger to stay up?
Yes, I'd say that. Also, I think a lot of people underestimate them.
Okay.
It's a lot of they don't take them seriously. They've just got promoted.
Where you predicting them to finish?
10th, 11th.
Okay, no.
I wouldn't say anything major.
I hope they do. Yeah. Anything you want to say before we bring it to the close?
No, I mean I'm not the best. I'm not the best person for like motivational kind of saying.
No, but just anything. Just I like to. Yeah.
Just keep on doing what you're passionate in, and sometimes quite hard to find that.
Yeah.
But I don't know. I feel like it's you should never be too old, and nothing should hold you back from doing it.
Yeah.
I feel like a lot of things with me is, because I'm in the mid-20s, and it's like, oh, should I go back to university to do X, Y, Z? But there's large people around you, who I've seen around me, sorry, who are different ages and they've done different things, and yeah.
Okay.
Keep on doing what makes you passionate.
Yes. No. Thank you, Jonathan. Yeah. I'm gonna just press stop on that.